Rogue Surgeon Narcissist. Hello, I'm H.G. Tudor. I've explained in the past that there are certain fields, certain areas of life that are honeypots for narcissists. Politics is a big one. By gaining political power, that allows a narcissist to control people. There is an entire country to be governed from which fuel can be obtained. Masses of people from which character traits can occur, and of course the residual benefits of facade management, access to wealth, access to networks. Therefore, political power and the political environment is one that attracts many narcissists. Entertainment, similarly. By entertaining millions of people, there's millions of people who can be controlled and receive fuel from. By being so well known around the globe, lots of people to meet and acquire character traits from, and of course, once again, the possibility of accessing a facade and gaining lots of money by being an actor or by being a pop star or by being an author. Thus, the field of entertainment attracts many narcissists also. Sport is another area, and also health. Last year, I ran a detailed analysis on Lucy Letby, who was convicted of murdering children. She's seeking to do something about that, more about her on another occasion. But the field of medicine is one which regularly attracts narcissists because, after all, what greater power is there than the power of life and death? The ability to save somebody's life, to be like a god. That would appeal very much to a narcissist. The fact is, by wielding medical knowledge, that allows people to control. Whilst people do question medical advice more than they used to, there's still many people who are completely beholden to what the expert has to say. That if that's what the doctor recommends, that's what they'll go along with. After all, they trust that doctor. The doctor has the knowledge. The doctor has the training. The doctor has the expertise. The responses of people, grateful for their health being restored, a loved one being brought back from the brink of death, the outpouring of gratitude to that surgeon, to that doctor, oodles of delicious fuel flowing in the direction of that narcissist medic. The different people that there is exposure to allows character trait acquisition, and in some instances money can be made from this. Certain surgeons are very well paid, particularly those with private lists. There is the opportunity, of course, to manage a facade, to be seen as a pillar of the community. But the control that can be wielded by telling somebody how they should live their life, by instructing others to perform certain tasks upon an individual for the purposes of keeping them alive, bringing them back from the brink of death, curing their supposedly incurable disease, for nursing them back to health, that is hugely attractive to the narcissist. And there are many instances of where narcissists have infiltrated a medical environment, resulting in difficulties, haughtiness and mistreatment of colleagues, malpractice against patients. And here we have an example of a rogue surgeon, which certainly suggests that narcissism is at play. Sean Linton writes in the Times about a rogue surgeon who's been investigated working at Great Ormond Street Hospital in the United Kingdom. There has been a review into 721 cases involving children who were all seen by the same surgeon. Serious concerns have been raised about his conduct, and as you'll hear, it certainly raises the possibility that this individual is a narcissist. With his confident air, superiority, self-belief, Yasser Yabar was a reassuring presence for parents on the orthopaedic ward of Great Ormond Street Hospital. Now, for those of you who might not be familiar, Great Ormond Street is one of the top 5 children's hospitals in the world, and it's one of the most technological advanced. It's an international centre of excellence in child health care. Since it was formed in 1852, the hospital's been dedicated to children's health care and to finding new and better ways to treat childhood illnesses. The hospital sees around 76,000 children each year, with around 250,000 admissions and appointments. Every day, around 750 seriously ill children and young people are seen at Great Ormond Street Hospital from all over the United Kingdom for life-changing treatment and care. Great Ormond Street Hospital provides more than 67 specialised services, the widest range at any one site in the United Kingdom. And it deals with rare and complex conditions such as rare cancers, genetic disorders, complex medical or surgical conditions. Every day, 333 operations are performed, and over 100 seriously ill children and young people are admitted as inpatients for life-changing treatment and care. It really is a magnificent hospital that regularly is in receipt of fundraising. I think, if my memory serves me correctly, Johnny Depp had made a donation there in the past, and it undertakes work for which people are hugely grateful. However, this particular surgeon may well have tarnished its reputation somewhat. The reporter explains that when the 43-year-old surgeon told the parents of a 6-year-old about the leg straightening and lengthening procedure he planned to perform on the child, he had their full trust. They were unaware Yabar's colleagues were concerned about his safety and fearful he was harming children in his care. In July 2021, Yabar operated on the boy at Great Ormond Street Hospital, lower limb reconstruction service in North London, which every year performs surgery on hundreds of children with illnesses or congenital deformities. The procedure involves surgically breaking the bone, then inserting metal rings, known as Ilzirov frames, and tension wires to hold the leg in place. Over the following months, the break is slowly widened by millimetres, allowing new bone to develop and fill the gap. Yabar performed so many of the operations he was referred to as the hospital as the frame guy. Immediately after the surgery, however, the boy's father, who asked not to be identified, knew something was wrong. In all of our meetings prior to my child's surgery, we were told a certain type of frame would be used to help rotation and lengthening. But when the procedure was done, a completely different frame was used. We were never told why, but it seemed strange, he said. After a couple of days, the frame became loose and my child was in a lot of pain. You could feel the bone in his leg, which felt out of position, like it wasn't lined up and was protruding the wrong way. We feared something was wrong, but when we raised it with Mr. Yabar, threat to control, he was very dismissive, haughtiness, and said it was fine, nullification of threat to control. An investigation by the Sunday Times has confirmed what happened to the family was not a one-off, but part of a wider problem with Yabar's practice and the culture of the hospital. Great Ormond Street Hospital has begun an urgent review of 721 children seen by Yabar in its orthopaedic department. This review is being conducted by 5 expert surgeons and is expected to take another 18 months to complete. Of the 37 cases that have been reviewed already, 22 children have been found to have come to some degree of harm, 13 of them classed as severe harm, that is, likely to include lifelong injuries. Thus, the suggestion that this man automatically knows what's best demonstrates an arrogance, a sense of entitlement, and questions his emotional empathy for those that he ought to be looking after. At least one child has had a leg amputated because of complications following surgery by Yabar. Another child is facing the threat of amputation if surgeons at other hospitals cannot save the limb. One of those harmed was just 4 months old at the point of surgery. Other youngsters have been left with legs at different lengths, some by as much as 20 centimetres. Some are living with chronic pain years after their operations and have endured multiple follow-up surgeries. Other injuries include muscle damage, nerve injuries and permanent deformities. Yabar stepped down from his role at Great Ormond Street Hospital last September after an 11-month sabbatical on full pay, agreed after concerns had been raised about his conduct, nullification of threat by withdrawal. After the complications following Yabar's operation on their 6-year-old, his worried parents sought opinions from other specialist surgeons in England and the United States, who confirmed their fears. The wrong frame had been used. They complained to Great Ormond Street Hospital, but were not listened to. We tried to raise our concerns repeatedly through the official complaints procedure, and I copied the clinical director into many emails, but heard nothing back. When they did an initial investigation, it just seemed that everything was being brushed under the carpet, and that was very upsetting. The father added, at the same time we spoke with some other parents in the hospital and they said their child also had a different frame to what they'd been told they would be used. It seemed odd. As time went on, their child was left in terrible pain, lack of emotional empathy, and had to have more surgery to correct Yabar's errors. A review of the child's care by the Royal College of Surgeons concluded the surgery by Yabar was incorrect and unsuitable. It said Yabar demonstrated a lack of understanding of the principles of deformity correction surgery in addition to a lack of insight. That comment demonstrates the arrogance and sense of entitlement of this man who thought that he knew best, that he deemed that he knew how to operate on these children, and his lack of insight is clearly demonstrative of the absence of emotional empathy. Yabar qualified from St George's Hospital Medical School in London and trained in orthopaedic surgery in Oxford and London. He did further training at Cardiff University and then went to work in Australia, spending a year at the Royal Children's Hospital in Melbourne and the Children's Hospital at Westmead, Sydney, before returning to the UK, where he worked at the Chelsea and Westminster Hospital NHS Foundation Trust before joining Great Ormond Street Hospital in June 2017. He also worked privately at the Portland Hospital in central London. The review of his care at Great Ormond Street Hospital follows a confidential investigation by the Royal College of Surgeons, which compiled a damning 100-page report on Yabar's practice and the wider department. It was completed in October last year, but not made public. The report, seen by the Sunday Times, is highly critical of the wider culture of Great Ormond Street Hospital, as well as what it labels the dysfunctional department where Yabar worked. It warned the lower limb reconstruction service was not safe for patients or adequate to meet demand. The Royal College of Surgeons described parents being terrified for their children, with some accusing the surgeon of lying to them, a form of manipulation, avoidance of accountability. It said Yabar had exhibited unacceptable and unprofessional behaviour, including being aggressive, heated ignited fury, and threatening towards staff, use of threat. His record-keeping was poor, lack of accountability. His assessments of children before surgery were unacceptable. And he carried out operations for which he had not sought proper consent, lack of boundary recognition, lack of accountability. Children were also subjected to surgery that had no clear benefits or justification. Sense of entitlement, absence of emotional empathy. The report said some staff who worked alongside Yabar would not wish for their friends and family to be operated on by him. He was also concerned of altering clinical records after surgery, perverting the course of justice, lack of accountability, and dismissing concerns, haughtiness, raised about the recovery of children after surgery. The review team heard of serious complications, with staff reportedly seeing more amputations in recent times than they ever had within the service, the report said. The college described one incident when a family were adamant that Yabar had lied to them, but it was not declared as an incident, and staff investigating found it difficult to challenge the surgeon. Other staff described Yabar as having a blasé and dismissive approach to complications, lack of accountability, haughtiness. One told the Sunday Times it was awful. He was very cavalier, and there were problems from very early on. We'd operate on children that we should not have operated on, sense of entitlement, lack of emotional empathy. They said, adding, he hid his complications, lack of accountability, and he didn't learn from them, repetition of behaviour, so they kept happening. Parents of children told staff they did not trust Yabar and asked for it to be arranged for them to see other surgeons. I feel like I helped some children, said one worker who was able to get families seen by other doctors. A number of staff said they raised their fears in writing. We were asking for meetings with managers, but they never responded. It's frustrating. You feel helpless, one said. The report paints a picture of dysfunction at the heart of the hospital, which some described as being run like a political organisation. Orthopaedic consultants behaved in outdated, unacceptable and hierarchical ways. Top doctors were described as eye-rolling, while also showing dismissiveness and hostility towards other staff members. On the wards, problems repeatedly arose due to bad organisation and communication and systems not being used correctly. For example, pain relief would be requested, then not administered. Medical equipment would not arrive in time. All of this put patient safety at risk. It describes the department where Yabar worked as plagued by surgeons who did not collaborate, saying there was a serious and palpable lack of effective team working in the department, which the review team considered to be largely dysfunctional. When parents tried to complain, they were dismissed. The college said the trust needed to improve its manner and tone in responding to complaints. Yabar's behaviour was finally exposed after a fellow surgeon, Sarah McMahon, who joined the trust in 2020, blew the whistle. She was brought in as a junior member of the surgical team, but is believed to have become concerned about the complications experienced by Yabar's patients. The two fell out, common with the narcissist, after McMahon took over the care of some of Yabar's patients while he was away from the trust recovering from a motorbike accident. Of course, him being away means he's not able to assert control over the problems that he has created. McMahon formally raised concerns about Yabar in June 2022 when she wrote to senior managers. This led to a meeting with the Trust Chief Medical Officer, Sanjeev Sharma, who commissioned the Royal College of Surgeons report. Great Ormond Street Hospital said it accepted the findings of the Royal College of Surgeons review and apologised to patients. It said senior managers outside the department first became aware of concerns in June 2022 and acted to commission the investigation within weeks. A spokesman said as part of the review, the Royal College of Surgeons raised concerns around the practice of a surgeon who no longer works at the Trust and other practices within the service. We are taking these concerns incredibly seriously. We have contacted all patients of the surgeon and a group of independent experts from other paediatric hospitals and are reviewing the care of all the patients of this surgeon. We are incredibly sorry for the worry and uncertainty this review may cause them. Now working in Dubai, Yabar is still operating on patients, which is upsetting a lot of our families, said one clinician from the team. Caroline Murgatroyd from Hudgell Solicitors is representing families treated by Yabar. She said the details indicate serious failures in care to many patients over a number of years. Thus, we see a consistent pattern of these behaviours of a sense of entitlement, lack of emotional empathy, lack of accountability, lying, haughtiness. It isn't a one-off. She added in one particular case, a child underwent an amputation after having been put through a series of procedures. In this case, the review panel found the amputation could possibly have been avoided with a different route of treatment. Other cases including evidence of unacceptable assessments, poor clinical decision-making and treatment of patients, as well as issues linked to consent, lack of boundary recognition, lack of accountability. She added there are also references to children being subjected to surgeries that the review panel could see no justification for, sense of entitlement, with children undergoing procedures that brought them no clear benefit. The findings so far have been shocking to read and have been very upsetting for our clients. Yabar declined to comment. Assertion of control by staying in a position of withdrawal, saying he would instead give an account to the relevant authorities at their request. Thus, this individual who routinely operated on children when it wasn't necessary and gave the wrong treatment has repeatedly, over a sustained period of time, demonstrated various narcissistic indicators which would demonstrate that once again the medical environment attracted a narcissist into its midst with the chaos and misfortune that follows thereafter. I'm H.G. Tudor. Thank you for listening.